Hi, this is Dees. Today is April 3rd, 2020. It's a Friday, the first Friday of the month of April. So I'm reporting at 9 p.m. CST. So the total number of cases continue to increase. So from United States, we have many more reviews coming in, and then we will have a recap of this week, what was happening and how this has progressed for over the last 10 days. So to start with, I'll give my personal updates. So I have been pretty healthy, doing pretty much things that I had to do in my research front, and also trying to keep my morale high, like talking to friends, talking to parents, talking to my brother, talking to my sister-in-law, kids, and all that. I'm pretty healthy. So far, I have not known that I have been in contact with anybody who has corona. Second, my friends are doing great all around me. They're trying to get their groceries stocked ramped up over the weekend. I think one of the things that they essentially should be doing, and they're trying to buy as minimum as possible so that they have only stuff enough to survive this 2 to 3 weeks. Great job. My parents, I talked to my parents today in India. They're doing great. They're also in self-isolation or stay at home. They do have all the necessary supplies, and I think the state government is taking ample enough action so that they have to ensure that all the shops are stocked with stuff and there is no shortage of any supplies. My brother, sister-in-law, and kids are doing great. I talked to them today. They are staying at home. They are mostly containing themselves to home, using this internet to work and then stream some news or some other services for their entertainment at their disposal. Kids have got their laptops, so most probably next week onward they will have classes. So let me dive deep into the numbers. So here is the total number of cases. That is 1,098,000 people have been affected all around the globe so far, according to the records. 59,159 persons have died from corona up till today. 228,000 people have recovered from the disease and is leading a normal life. We do not know whether they have gone into the mainstream life, all of them, but eventually they will be all inducted back into society. We will go into the new cases. This is also something which is so different that we have seen over a couple of days. United States, the total number of cases reported is 227,000, sorry about that. 32,284 cases were reported today. That's like a lot of it is coming in from New York. Italy, 119,000 people have been identified as corona positive so far till date. 4,585 cases were recorded today. Spain, 119 cases again. 7,134 cases recorded today. So in both these countries, in the United States, you see the trend is going up, but in these both two cases, these numbers are slowly and gradually coming up. So at least in Italy, we can comfortably say that the lock-in place measures have taken its effects, and we are seeing the flattening of the curve, and then slowly we are moving down the curve. Spain, I think hopefully will do it in a couple of days. Germany, 91,159 cases, 6,365 cases reported today. That is still less than the day before. That does not give any conclusive evidence about Germany though. I think it's just a number. Probably we will see more detail from tomorrow. China, 81,620, 31 new cases. I think all these numbers from China and Italy, that we can see that they have sufficiently and enough amply seen the top of the mountain, and they are seeing the descent at least. In China, they have done it long ago, but I think Italy is seeing it pretty soon. Italy has already seen it. It's like moving down the curve. So death in terms of country. So we can see that again, Italy has the highest death toll so far. 14,681 people have died so far. 766 people have died today. This number is almost same as the number that we had yesterday, so there is no much of change here. Spain, 11,000 people have died in Spain. 850 people have died today, so that number is also coming up. We do not know whether that number indicates a trend line or it's just a another point in the chart. United States, definitely one of the things that we can see is that 7,392 people have died so far. The number of deaths just from New York has grown over 3,000 people. 1,321 people have died today. France, 6,507 people have died. 1,120 people have died today. That is lesser than the number which we have seen yesterday, but we have to get more details from the France, what is happening exactly there. UK, one of the countries in Europe, 3,605 deaths have been recorded so far, 684 cases recorded in total today. I think these numbers from UK are really alarming. We have to see that these numbers are going down in coming couple of days. Social distancing is indeed helping us. We do not have a medical intervention. One of the only intervention is the one which we have with the social intervention. Social intervention is proving to be really great. At least we know that from China and Italy. So we will gradually going to see that effects in other countries, including United States and UK and France and all these countries really soon. So majority of the updates that I wanted to say that how United States has progressed in lock-in-place or shelter-in-place orders. On March 23, starting with the state of California, on March 23rd, there were 9 states which were having lock-in-place. And on 26th of March, we had 21 states who has established some sort of curtailment of public movement. On 30th, there was 30 states. On 30th of April, on 30th of March, and we are literally 5 days away from that. 41 states have made the public movement minimal, and stay-at-home orders are being issued in this 40 states. Latest of which are Alabama and Missouri, where the cases are rising. So there are effectively 311 million people in the United States that are stay-at-home, covered by this law, and 41 across 41 states. So it's also a luxury for us to stay in home because there are people who are afraid of going out, but still they have to be there in the front line because they are leading this effort in order to contain this disease. So thanks to all these people who are working really hard, not only in the United States, but all across the globe. CDC has reviewed its possible use of masks. It has recommended each of the individuals to have a mask if you are going in public. So I think that's one of the amendments that you have. But this amendment is like slightly, it has more details to it. So you cannot use surgical mask or any other sort of mask because these are being increasingly used and are in demand for the hospital use. So these kind of masks that you can use are the real small masks which you can wash and reuse and kind of stuff. Another update is from Javits. So Javits Center is going to be converted into a corona hospital because initially it was supposed to be treating the non-corona patients, but non-corona patients are so less, so they are trying to convert with the federal help into corona inpatient treatment. So 10 million joblessness has been reported. 10 million people have been signed up for this job loss of job. Another economic reform or economic boost effort from the bill is coming up. There is sad news from Texas, which is like there is a nursing home in San Antonio, of which 66 of the 84 residents have been identified positive for the COVID, and all the people who are trying to help these people, who are taking care of them, has gone into multiple facilities in order to take care of people in different facilities. So state of Texas has modified its law in order to, which is preventing the workers working in this nursing home to go between multiple hospitals or multiple nursing homes where the old age people, older generation are being taken care. So for a week, this week was very, very important in its history, I can say. A lot of lock-in-place, stay-at-home, shelter-at-home, so place orders were placed. A lot of Javits was opened up early in this week. Deaths have, the number of cases has gone over 1 million Number of deaths in New York City has grown over 30,000. Total deaths has crossed 50,000 in total all across the world. And in some other news, which is like the number of cases that you have. One of the things that we are seeing is this economic disparity. So the rich people can equally, or like we are facing the effect. The poor people are going to get the effect of the COVID faster than the people who are rich, because the rich people can once the state has put the stay-at-home orders, they are able to stay at home on exactly at the same day or in a couple of days. But to follow the same suit, the poor communities are taking at least 3 more days. So that's like something which is alarming. Probably we'll catch up. Probably it's really catching up, really in some places. But I think that's one of the alarming cases that we might have. So this week was very eventful. Very people are in the forefront. A lot of changes in policies. A lot of new policies are like, people are being asked to produce some of the essential medical supplies. And New York is one of the states that is leading that effort. They are trying to get as much medical supplies as possible from local New York area. So I think we'll watch out for the progress in the next week. So by that time, till that time, we will keep a tab on how things progress. Thank you so much.